Vampire facial. How often do I need to get them going forward to keep up with the results? I have some minor acne scarring, and my skin is not as tight as it used to be. I received my first vampire facial and liked the results. How often do I need to get them going forward to keep up the results?
Thank you for your question. You submitted your question without a photo. However, you stated in your question that you had a vampire facial to address some minor acne scarring and some skin tightness, and you are pleased with the outcome and you want to know how often you need to do this treatment in order to maintain results. Well, in the absence of photos and some clinical history, I can give you some general concepts that we employ in our practice to guide patients like yourself. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. The vampire facial, just for the clarity of definition, is essentially an approach to helping skin quality through microneedling at different depths to induce something or refer to something called collagen induction therapy. And the element that enhances that with PRP is a significant element to maximizing the skin's response to this stimulation. Basically, controlled injury resulting in skin tightening and improvement. So to answer the question, first we have to look at what is the underlying concerns. You said your skin was not as tight as it used to be. Well, I would suspect that if we're dealing with an element of facial aging, then there's a possibility that you're also dealing with volume loss that is deeper than just the skin surface. As we have become much more aware of facial aging variables, it's important to recognize that facial aging is not just loss of fat, it's loss of bone, muscle, fat, the soft tissue. Very often people with acne scars will see those acne scars appear more obvious or more prominent with facial aging. One strategy that might be worth employing that we've had very good experience with is actually placement of fillers at the deeper levels of the face, such as between the bone and the muscle, and we call that structural volumizing. For example, we've treated patients with volume loss who are getting treatment for acne scars, and they had lasers and various injectables, but everything limited to the skin level. When filler was placed at the deeper level, that volume restoration actually helped smooth out the acne scars considerably. Now, generally speaking, if you have minor acne scarring, then chances are you should be relatively responsive. Now, there are different types of acne scars, and that's outside of the scope of this discussion. However, in terms of timing, with something like the microneedling vampire facial type procedure, a lot of times I have to look at my patients in a way where I observe how their skin is responding and evolving. A lot of my colleagues like to do microneedling every 2 weeks. Some like to do it every month. What I prefer to do is look at the response and I make adjustments accordingly. There is a wound healing process anytime there's an injury, whether it's a poke or whether it is an incision. And it's a process that is basically the most important part that's relevant for you is the proliferative phase and the remodeling phase. So basically it's 2 parts. Proliferative phase is in the first month. The body is generating collagen, blood supply, and all kinds of good things to help repair this injury. The remodeling is the rearrangement and settling out of that response. And so you can consider, based on your skin thickness, your skin type, the rate in which you heal. I like to look and see how those variables can be optimized so that the timing of the microneedling and PRP treatments can be done in a way that's most effective. But I would say that, so from that perspective, you can certainly go more frequently, or you can allow for some time and give your skin a chance to heal and remodel and plateau and then do another treatment. So it's about customization. I think that it's also important to look at other options to maximize your results. You may you may consider treatments such as Q-switch laser or fractionated lasers to help further maximize the quality of the skin, as well as the use of topical retinoids and other things to help the skin quality. So discuss this with your physician and see what is optimized, what will be optimal for you and what is practically achievable given the usual time constraints and resources that one can actually allocate for an aesthetic purpose. So I hope that was helpful. I wish you the best of luck, and thank you for your question.